So we would like to acknowledge the Turrbal people, traditional owners of the land on which we're all meeting for this conference, and pay our respects to elders past, present and emerging. And we'd also like to acknowledge that there may be people in the room with a bloodborne virus and also that they may have experienced stigma and discrimination in their journey. So research and anecdotes from both people with bloodborne viruses and nurses tell us that stigma and discrimination is still a really significant issue that impacts access to treatment and management for people with hepatitis B, hepatitis C and HIV. Stigma and discrimination often manifests itself in poorer health outcomes, and when these outcomes are shared as stories, they can become really powerful tools.
There really is a lot of stigma around Hep C, and I suppose on some levels health workers have to do with stigma.
Oh, that wasn't very good. Sorry. I'll try that again.
There really is a lot of stigma around Hep C, and I suppose on some levels health workers have to do with stigma about a lot of things, but this is very specific and it's very related to drug use.
As we've heard throughout the conference, nurses really are leaders in change, and we have great capacities to become a great capacity for innovation to lead the elimination of stigma and discrimination. The free online learning module that we're developing provides an opportunity for nurses to really reflect on their attitudes, perceptions and behaviours towards stigma and discrimination, and encourage their colleagues to do the same. Nurses will also be challenged to consider the structural barriers within their workplaces that also promote stigma and discrimination. Underpinning the module is ethical and clinical policies and standards that all guide our practice, our clinical practice. And for the first time within the national strategies, stigma indicators, measurable stigma indicators will be embedded as part of those strategies, and this work will help us reach some of those measurable indicators. And the strategies are due for release by June 30 apparently.
So what will the online learning module look like? So the module will take about an hour for participants to complete, and it opens with an introduction of nurses sharing their perspective of why this is an important topic. And then throughout the module there are videos of lived experienced videos like the one you saw earlier, and this will help nurses really understand the impact that their care can have on people who are living with bloodborne viruses. And the content will address stigma and discrimination in the context of topics like the nurse's role in reducing stigma and discrimination, colleagues with bloodborne viruses, treatment and management, disclosure, and also culture. So these are all topics that can really impact the experience of someone accessing care with a bloodborne virus, but can also really influence the care that a nurse provides as well. So there'll be a number of reflective activities. So the module is really designed to be interactive and reflective. So some of the reflective activities, so this is a reflective question. And this isn't, we won't be recording answers to these questions, but it's an opportunity for the nurses who are participating to pause and reflect on their own practice. There'll also be some reflective activities where we do collect some answers, and this is an example of an interactive activity, and these are taken from the Stigma Indicators report by the Centre for Social Research in Health at UNSW. And as I said, we will be collecting these answers, and this will form part of the evaluation. So the evaluation will be piloted to 100 nurses and will assess changes in knowledge, attitudes and practices. And so at the beginning of the module, participants will answer some knowledge-based questions in the format of multiple choice questions, and they'll also be answering some scenario-based questions similar to the scenario on the previous slide. And answers to these scenarios will provide measurements in attitudes and practices. And so this will be embedded in the module, and those answers will form the baseline for the evaluation. And then at the end, participants will also be asked similar knowledge-based questions and scenario-based questions, and these will be compared to the baseline measurements. So those questions will be embedded in the module for ongoing monitoring and evaluation. But in the pilot, there'll also be a 2-month follow-up which will assess sustained learnings and application to practice. So that again, they'll be asked the quiz-based questions, scenario-based questions, but then there'll also be some qualitative questions that will assess how the learnings have been applied to individual practice, organisational practice, and we'll be able to see if there are any changes in things like policy, procedures, protocols and culture. And so why is this online learning module relevant to your practice? Well, I think that's best answered by some of the nurses in the introduction video, and also by some of the people who've been kind enough to share their lived experience. So these are videos that will be used in the online module. Just bear in mind that it is raw footage. It hasn't been edited for the module yet, but we'd like to share it with you today.
As nurses, our goal is predominantly to care for our clients in a holistic manner that's culturally sensitive and it treats everyone as an individual and with respect and care.
Nurses have an opportunity to be leaders in eliminating stigma and discrimination. We will need to challenge our own attitudes and beliefs, those of our nursing peers, and also the organisational structures that we work in to create these barriers to care for people living with HIV, hepatitis B and hepatitis C.
The positive experiences I've had from healthcare workers and nurses made it a heck of a lot easier for me to look towards treatment for me and my disease. Because I wasn't fearful. Some people in society made me feel, like I said, unclean. But the nurses and the healthcare workers that gave me the positive experiences made me feel like, hey, this is okay. Maybe all people associated with hepatitis C were these kind of people, so it made it a heck of a lot easier.
The module has been developed in collaboration with nurses and people with lived experience, representatives from these following groups, and it has been an absolute pleasure to be working with them and having them help us to bring everything together. As Karen Booth mentioned in the opening plenary, nurses really are a force to be reckoned with. And I think with our collective efforts, we are really strongly placed to lead the elimination of stigma and discrimination for people with bloodborne viruses accessing healthcare. And we invite you and encourage you to join us on this journey by completing the module when it's released later on in the year. Thank you very much.